Hi there everybody, my name is Joel Johnson. I work for Quest Diagnostics. I want to welcome you today and thank you for being a volunteer phlebotomist. Quest Diagnostics is partnered with 9 Health Fair to bring you this training today. We want to make it quite clear to you that this is not a phlebotomy training. We're not showing you how to draw blood. We're merely giving you an overview of what you're likely to expect when you get out to the site where you'll be drawing that day. And to open up the training, I would like to give you 5 points that will take you up to the beginning of the fair. The first one, plan on being at the site an hour before the fair starts. For an example, if your fair starts at 7 a.m., we would like you there at 6 a.m. And when you come in the employee entrance, the first place you want to go is the volunteer table, where they're going to ask you to fill out and sign a volunteer registration form. Once that's complete, we'd like you to proceed right to the blood draw area and connect with your lab supervisor. Your lab supervisor is going to have a form called the Volunteer Phlebotomy and Centrifuge Agreement, which they're going to ask you to read and sign. The last thing that we want you to do is be available for a brief training held by your lab supervisor, which will be about a half hour before the fair starts. Your lab supervisor is going to give you some pertinent information about that site in particular and how the participants flow through the blood draw area and where you send them once you've completed the draw. Now let's look at the participant forms, the regular form and the electronic form. First, let's look at the regular form. Let's focus on 4 main aspects or sections of this form. The first section pertains to the participant demographics. Everything you see at the top of the form in yellow needs to be filled out. Full name, gender, age, date of birth, address, and phone numbers are very important. This helps 9 Health Fair to get a hold of the participant in the case of a critical result. You can see that the SSN or Social Security number is in white and is not required. Please make sure that the gender box is marked properly. The email section is in yellow, but is not required. Please check the box for hours of fasting. To the right of the participant's demographic section, you will see 4 pre-printed stickers with numbers. These stickers are to be placed around the top of each blood tube drawn. This will be demonstrated later in this presentation. The third section of importance is the test payment box located right under the demographic section. This box contains the test the participant wants done: blood chemistry panel, PSA for men, blood count, vitamin D, and hemoglobin A1C. It is very important that there is an X to the left of the pre-printed test. Also look to see if the tests chosen have a price filled out to the right of each test, and there is a total at the bottom of this box, which confirms payment. The last section is at the bottom left corner where the participant signs the form, which is highlighted in yellow. If the form is not signed, please ask them to do so. If they are unwilling to sign, but they have paid for the testing, go on and draw them anyway. Note, the witness signature does not have to be signed. Now let's go over the electronic form. This form is very much like the regular form, except that it is computer generated. The main difference on this form is that there is no pre-printed stickers attached like with the regular form. The stickers are given to the participant to give to you when they sit down to be drawn. The first printed sticker contains a barcode and is to be placed in the box located at the top right of the form. This is very important because this is the only thing that ties the form to the blood tubes. The other stickers are to be placed at the top of each tube drawn. Please don't make any changes to the electronic form. Regardless of what form is being used, a frequently asked question is, when will I receive my results? To the right of the test box on the regular form, it clearly states that their results will be mailed to them within 4 weeks. Now, we want to introduce you to the blood table. And you can see that we have a chair on both sides. These are for the participants to sit in while their blood is being drawn. We also have chucks for them to rest their arm on. We have sharps containers. I have a blood draw kit with vacutainer needles, gauze, alcohol, tape or Band-Aids, and tourniquets. In this box, we've got purple top tubes, SST or tiger top tubes, and single-use hubs. The last thing I've got on the table are gloves, and we have various sizes that will fit you. Let's talk about the sharps containers. There's a 9 health fair rule that every phlebotomist have their own sharps containers. So you can see that we have one for both stations. Everything else on this table can be shared between 2 phlebotomists. Now, let me show you a butterfly. I want you to know that butterflies are not the standard needle used in 9 health fair drawing. These are normally reserved for the hard stick table. These are for difficult draws only. When a participant sits down at your table to be drawn, they're going to hand you their form. So real quick, look over all the yellow highlighted areas to make sure they're filled out. Also, you double check the test with the participant. To properly ID them, you want to ask them to state their full name and date of birth for you. Make sure that you have the right participant with the right form. After that's done, assemble the supplies and gloves. 9 health fair has a rule about gloves, that they're to be worn on both hands for the entire draw. And if any participant brings up latex sensitivity, you can assure them that none of these products on this table have latex in them. Let's talk about the tubes that you're going to draw for each test. So again, on the form, the first 2 tests are the blood chemistry screening and the PSA for men. That is 1 SST top. If the participant chose the blood count and or the A1C, that is 1 purple top tube. And if they've chosen the vitamin D, that's an extra SST. So the most you're going to draw are 2 SSTs and 1 purple. For proper order of draw, you always draw the red tops followed by the purple top. Now let me show you the vacutainer system. We have a single-use hub and we have the BD safety needle, and I'm going to take the back off of the needle and I'm going to screw the hub onto it. This is the clipped safety sheath. Pull this back facing you. That ensures that the bevel of the needle is up, and then you do your stick. And you put 1 tube in at a time, starting with the SST tops. And as you finish those, make sure that they're properly mixed 8 to 10 times. When you withdraw the needle, hold a piece of gauze over the punctured site, thumb close the eclipse over the needle, and then throw it away. While the participant is holding the punctured site, sitting in your chair, you want to label the tubes. On each tube is a sticker, and you want to label their last name, comma, first name, the time that you drew them, and your phlebotomist initials. Once you've done that for every tube that you've drawn, you take a label, sticker, and you place it around the top of the tube, just like that. Once you put the stickers on the tubes, then you want to check the participant's arms to see if they've stopped bleeding. If they have, then double the gauze and tape it down and ask them to leave the gauze on for at least 10 minutes. The last thing you do before they leave is tear the form apart so the white copy stays with the blood. That's the lab copy. The yellow copy is given to the participant when they leave. Now I'd like to show you the proper way of racking tubes when you're done with the draw. You can see in this rack we've got several participants' bloods already. The first row is for the purple tops only. The second row is where you would put the chemistry, PSAs, and the third row is for the vitamin Ds. So for what we just labeled, these are the tubes that we just labeled. I'm going to rack them for you. I'm going to lay this down, and the last thing I want to do is take the lab copy of the form, turn it upside down on the rest. Well, we're about done with the training, but I want to give you some things to remember. Another term would be rules of the road. 9 Health Fair has a one-stick rule, meaning if you miss the participant the first time, do not attempt a second draw. Rather, send them to the hard stick table. When you're labeling your tubes, do that in front of the participant. Do not pre-label tubes. The last thing, watch the participant for signs of fainting. If the participant starts to complain about being a little lightheaded or a little dizzy, ask them to lower their head as far into their lap as they can and take some deep breaths. If that doesn't work and they start to faint on you, grab someone to help you, lower them to the floor, immediately get a hold of your supervisor who will get emergency medical people in to take care of the situation. So before we close out this training session, I want to talk about needle stick injuries. Heaven forbid that you should ever suffer a needle stick injury, but if you do at 9 Health Fair, I've got 3 points for you to remember. The first, if this happens to you, immediately get a hold of your supervisor. Have them come over to help you. As soon as you can, break away and go wash the punctured site thoroughly with soap and running water. After you've done that and you've quit bleeding, we would like you to return to the blood draw area and connect with your lab supervisor where they're going to give you further instructions. So in closing, I want to thank you again for volunteering to be a phlebotomist. And I want to leave you with 3 points. The first, stay safe. Everything that I've covered today will help you do that. The second, don't hurt people. If you detect signs of body language that you're hurting them, please withdraw the needle and have someone else do the second stick. The last point is to please have fun. That's what 9 Health Fair is all about. So thanks for watching, and we'll see you at the 9 Health Fair.